No, it says. Hi, this is Dr. Epstein with a patient that's had some work done, you said back in the 70s? All right, you can see he's got this very prominent 2 to 3 rows of plugs, and the older technique involved the creation of a wall, and then he has very little throughout here, and then lastly has some grafts back here. Let me go ahead and turn around. There's also some scarring in the donor area. You can see these plugs here. Chin up for me just a little bit. And then also we can see the scarring he has in the donor area. So what I'm going to do today is I'm going to take a relatively aggressive approach, not the most aggressive approach, but one of the more aggressive ones. The most aggressive would be to do essentially a brow lift, excise this entire frontal area, removing around 3/4 of an inch, 1/2 inch to 3/4 of an inch of scalp, and bring this up and do that. But I don't think we need to in his case. What I'm going to do instead is a lot of these very prominent 8 to 10 hair plugs, I'm going to reduce them in size. So I'm going to do a lot of punch reductions and punch removals, and then I'll do some grafting in front of the hairline, and then I'll go ahead and plant further grafts in here. So it's going to be a combination of taking some hair from the back of the scalp, which will provide me with the donor hair, and then planting it, if you look here again, planting it throughout here and along the hairline, and removing these a significant amount of the hairs from these rather large plugs, reducing them in size. So my hope would be to reduce the density along this frontal area by around half, do some single hair and double hair grafts, softening of the hairline, but with the hairs that we take out from here, replanting in this mid-scalp area, and lastly doing a little bit of punch reductions as well of the crown region. Procedure itself should take around 5 hours, and we're all set.